And welcome to Wellness Wednesday. This week, I'm super excited because we're going to talk a little bit more about arthritis. We're going to talk about number one, what causes it. We're going to talk about how to reduce the pain of arthritis and reverse the joint damage. So we're going to talk a little bit more about what you specifically can do for your own health and specifically your joint health. So let's start talking a little bit more about anatomy of your joints. So you have so many joints in your body. You literally have joints in your jaw. You have joints between the bones of your skull. You have joints in every single bone of your spine. You have joints with your ribs, your shoulders, your knees, your hips, everything. And those joints help to make sure you can move. Now, what can happen is over time, if we have a specific injury that causes the joint not to move properly, or wear and tear, or even some specific health problems that can cause those joints to wear down faster, as they wear down faster, they can cause a lot of different symptoms and a lot of different difficulties for you. So we're going to start with normal anatomy. So this is what normal bones in your spine look like. So you have the bones stacked on top of one another with a cartilage disc in between. And if we look out the side here, so between those bones, there's a hole, and that's where your little nerves go through. There should be plenty of room in between the bones to allow those nerves to function. Now, what can happen is if we have an injury that injures that disc and that disc starts to break down, we can start to see where that disc material gets thinner and it can wear down and even cause disc bulges and herniations. So when we look at the spine, we want to make sure those bones are stacked on top of one another nice and easy. We want to make sure we've got plenty of room for the disc in between the bones and plenty of room for that little nerve there to do what it's supposed to do and tell your body how to function. Now, those nerves go to every single cell, muscle, and organ in your body. So if you do have pressure on that nerve, even the weight of a dime cuts off about 60% of nerve flow. So it doesn't have much pressure to cause an issue. Now, the longer that pressure is there, we can get more and more damage over time. Now, typically when we have a bone that is not moving properly or is stuck in place where it's not moving how it's supposed to, we are going to start to get wear and tear, and that'll start breaking those bones down faster. So over time, now if you had a severe trauma like a car accident or a sports injury, or say you slipped on some ice and that happened very traumatically all of a sudden, we can see that arthritis process and that degeneration almost immediately, and we can see that damage in the joints almost immediately after that accident. Now, if you have little damages that happen over time, so say you sit at a desk all day, say you have bad posture when you're working on your computer, or maybe you do a lot of repetitive motion at work, or maybe even some weird sleeping positions that can cause damage over time. Those can take years to happen. A lot of times we may have little damages that add up over 3 to 5 years before we start seeing damage. But like I said, some of those traumas where we have it happen all of a sudden, we can see those issues right away. So this is what happens when we look at about 3 to 5 years of damage. So you can see if we compare, so I've got, this is the normal right over here, and then this is the phase 1 of degeneration, or basically about 3 to 5 years of minor traumas, or like a car accident or something like that where we have severe traumas. So what actually happens is those discs get worn and torn, and they actually start to break apart. So if we look, that disc is made up of rings of fibers, and those rings can start breaking apart, and we can get inflammation in the center of that disc. And when that happens, that disc can be very painful, and it can be hard to move in certain positions without pain. But the other thing too is because that cartilage is getting smaller, those holes where the nerves come through get a little smaller. So we're more likely to have nerve pressure. We're more likely to have muscle tension. We're more likely to have some restricted motion. Now, sometimes after a car accident, we can have a lot more muscle trauma, or like a severe trauma, we can see a lot more muscle spasms. We can see ligament damage. If we have those micro traumas or the little damages that happen over time, we may see where gradually it starts to worsen. It doesn't like all of a sudden get awful. And what can happen is in that first phase, if we start to see that degeneration happening, we will start to see not only cartilage damage, we can start to see the bones start to compress, or we can see the bones start to thin in certain areas, and that can predispose us to having arthritis later on down the line. Now, typically when we have that wear and tear, and over time it gets worse and worse and worse, when those bones aren't moving, your body will try to adapt. So your body will actually build extra bone to support that extra pressure on that joint, and that's how arthritis forms. So if we look at our next phase, so this is phase 2. So we went from normal, right, to phase 1, which is where we start to get some thin of the disc, and now we're at phase 3. So this is actually where your body has adapted. And typically we have about 10 to 15 years of those kind of smaller traumas, or about 2 to 3 years after a severe trauma. And what happens is your body will actually build these little spiky bone spurs. This is called osteoarthritis. And those little bone spurs there can actually irritate the muscles and ligaments that attach. But the other thing to realize is that disc material has now started to break apart. So those little rings that make up that disc have broken apart, and that middle portion starts to bulge or slip, or sometimes it can even poke way out the side and cause a disc herniation, where that disc herniation points directly and presses on that nerve. So in my office, when I have somebody coming in that has this arthritis and this pointy bone spur here, typically we can do some adjusting to try to get the joints moving, but that disc material can really cause a lot of issues, because what happens is when we have that middle portion bulging or slipping through the layers, that can cause a lot of pain. If it bulges outward and actually herniates, it can actually damage the nerve. And if you look and compare those nerves, so this one here is a little thinner than this one. What actually happens is we damage the nerve itself when this happens. And that arthritis is not just in front of the joint, but we can also have arthritis here in the back of the spine. So you can see where those bones normally come together. And I'm going to show you the normal just to have a comparison. So normally those bones should be kind of interlocked with each other, no spiky things. There should be plenty of free moving motion there. You should see there's some space in between there. But this one, because we have that arthritis forming, what happens is you lose some space and you get some of those spiky bone spurs on the back of the spine. These are not really meant to bear weight. So sometimes when we start getting some of this altered sensation or altered pressure, these can start to break apart and we can actually get degeneration fractures in this area. So this here is, like I said, phase 2. So this is about 10 to 15 years of small traumas, or about 2 to 3 years after a severe accident, we can see more damage. And at that phase, typically you actually have arthritis, you have disc issues, you may have muscle weakness or even muscle loss at that point. So it's a lot more involved to help manage that pain. And sometimes it takes a lot longer to get results because of that too. Now, if we don't do anything at that phase, we get to the point of permanent damage. And this is phase 4. So what actually happens is those bone spurs have gotten a lot worse. These bones will actually fuse together. And when the bones fuse together, that is not 2 bones, that is now 1. There is nothing we can do to break that apart. Sometimes if you've heard of somebody having a spinal fusion surgery, they'll actually do this with plates and screws. They will put plates on the sides of the bones and even screw into them to basically fuse those bones together so they can't move anymore. The problem is when you have those bones fused together, that disc cannot get the nutrition that it needs, so it starts to actually kind of dehydrate and die off. And then because we've got that arthritis that's formed so badly, you can even see that in between the bones, there's no room for that nerve. So we actually can start to get nerve atrophy and damage. And the back of the spine, you can see that there is literally so much space that has broken down, and there's that little bone spurs formed around those joints. So those may not move very well. And typically at this point, we may have some pretty severe pain. So what tends to happen is when your bones stop moving, they start to wear and tear. And over time, they can get worse and worse and worse until they fuse together. So it's very important to make sure that your joints stay moving. That's why it's important when you have arthritis to stay active so they don't break down faster. Now, really what it comes down to, though, is when you have joint damage or you have arthritis forming, we have to do some things to help manage and reduce that pain. So in our office, we do a combination thing. So number one, we do offer chiropractic care to get the joints moving. We offer non-rotational adjusting, so we don't do those popping, twisting style of adjustments. We have very gentle options for chiropractic care in our office to get those joints moving and restore motion. But in some cases, we may also need to start working on stretching up muscles and ligaments. We may need to work on strengthening those muscles to get your body working properly. But in some cases, you may need some extra support with some supplements or some nutritional changes that can also be helpful. One of the most important things I find, especially when it comes to your joints, is you need some natural anti-inflammatories. So natural anti-inflammatories are things like omega-3, so what you'd find in fish oil, seafood, any of your grass-fed products that are out there. Typically any of your Mediterranean style oils, so everything from olive oil to truffle oil to avocado oil, those things that are anti-inflammatory are very important. We also want to make sure that we have some support for our actual joints and that cartilage between the joints. That cartilage is actually it's a cartilage, but there's also some material inside of there that helps to basically rehydrate the disc. So one of the things that's really helpful for that is number one, we've talked about this already, but our glucosamine chondroitin with MSM. So the glucosamine chondroitin actually can help to regrow some of that cartilage. And the MSM is actually a joint pain reliever. Now, the amazing thing about MSM is you can take it by mouth and it'll actually spread systemically to help your body to support healthy cartilage and healthy joints. But there's also some MSM creams that are over the counter that you can apply on joints that have arthritis to give you some topical pain relief too. So there's a lot of options with that. But typically the most important things when it comes to reducing pain is number one, get those joints moving. Number two, get some hydration in there. So moving, stretching is really important. Taking some supplements to help with inflammation is also really important. But then the other thing too is we need to make sure they stay moving. So it's very important to make sure that we do exercise to keep our muscles moving, because if you start losing muscle mass, you get more pressure on the joint, which is going to cause more arthritis, more degeneration. So very important that you keep it moving, keep the right nutrition, and then also make sure those muscles that support your joints keep working as well. And we talked about the number 3 thing we can do to reverse joint damage, and that is keeping those joints moving. So one of the most amazing things about our bodies is its ability to adapt. So if we take pressure off of those bone spurs and those extra pieces that have bones that have formed, if we take pressure off of that area and we're not actively using it, your body's going to figure out, hey, we don't really need that extra calcium over here. We're going to go ahead and take this calcium magnesium. We're going to break it down and go take it elsewhere and put it in the other parts of the body that need those nutrition. So your body will actually resorb bone spurs that are not being used. So if you can restore normal joint motion over time, typically it takes about a year to see bone spur formation change. But what I find is when we can get the joints moving and get that hydration and the pain level down and reduce inflammation, your body can start the healing process. Your body can actually regenerate some of that nerve damage. Any of the nerves from the spinal cord outward, which is called your peripheral nervous system, can regenerate. Typically, it takes about 3 months to see about 1 inch of nerve start to heal. After 6 months, we can start to see that cartilage come back if we have the right nutrition and are absorbing that nutrition properly. And after about a year, we can start to see that bone spur broken down if your body's not using it and being reabsorbed for other areas of your body. So that is super important. I hope you learned something today. I feel like a lot of times when it comes to arthritis, it's very misunderstood. Now, there are different types of arthritis. There are also autoimmune types of arthritis, things like lupus, things like rheumatoid arthritis, things like ankylosing spondylitis. Those are a little bit different. Those are more related to immune function. Same thing applies. Anytime we have joints that are breaking down, we still want to do those things that we talked about. However, there may be some other things we need to work on, like reducing inflammation and kind of calming down that immune system if we have those other conditions going on. But hopefully you learned something today. So thanks for tuning in for this Wellness Wednesday. Join us next week to learn a little bit more about how to reduce that pain naturally. We have 4 secrets we're going to be sharing with you. Have a great rest of your day. Thanks for tuning in to Freedom Chiropractic and Holistic Health. Don't forget to hit that subscribe button and ring that little bell so we'll let you know about some new videos coming out. Every Wellness Wednesday, we go live at 5.